Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country, sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID webpage, usually within 3 business days. Many times, we will have the recording up on the webpage well before 3 business days. Let's take a look at the agenda for today's call. Today, we are pleased to have Dr. Christa-Marie Singleton, the Associate Director for Science and Science Lead in the Center for Disease Control's COVID-19 Response Chief Health Equity Office. Our topic for today is keeping communities safe, mask up, before, during, and after the COVID-19 vaccine. So what's this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of calls is available to you bi-monthly, offering a variety of topics. Before we start with our presentation, we wanted to share a new resource with you. Tips to help you boost your physical and mental health during COVID-19 was developed by patients for patients and offers 10 practical tips for coping in this environment. You can find this resource and others at kidneycovidinfocenter.com. This webpage offers a variety of information, including handouts, webinars, videos, and links to trustworthy organizations. Let's begin our presentation. As our speaker goes through her presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. At this time, I'd like to introduce Dr. Christa-Marie Singleton. As I mentioned, she serves as the Associate Director of Science and Science Lead in the CDC's COVID-19 Response Chief Health Equity Office. She is also the Senior Medical Advisor in the CDC's Office of the Associate Director for Policy and Strategies Population Health and Healthcare Office, where she serves as the Senior Medical Advisor regarding planning and commercial insurance partners and physician providers regarding clinical to community population health interventions to improve health and control costs. Prior to joining the CDC, Dr. Singleton was the Chief Medical Director for the Baltimore City Health Department, Office of Public Health Preparedness and Response. She has worked nights and weekends as a pediatric physician and is board certified in public health and general preventive medicine. Welcome, Dr. Singleton.
Thank you, and thank you for the opportunity to be with you this afternoon. Again, I'm Dr. Christa-Marie Singleton. I am currently serving as the Associate Director for Science in the Chief Health Equity Officer Unit in CDC's COVID-19 response. Today, I'm going to discuss the science behind mask wearing and why it's important to continue wearing one after you've received a COVID-19 vaccine. Go to the next slide, please. And the next one after that. So before I begin, I'd like to give a little background on CDC's Chief Health Equity Office Unit. The population health impact of COVID-19 has exposed decades, if not centuries, of inequities that have undermined the physical, social, material, and emotional health of racial and ethnic minority populations and other population groups that are bearing a disproportionate burden of COVID-19. To accelerate progress toward reducing COVID-19 disparities, CDC established the Chief Health Equity Office, or CHEO unit, in our COVID-19 incident management structure. Our unit's sole focus is to ensure that there is an all-of-response approach at CDC to identifying and addressing health disparities. This is the first time in the agency's history that a senior leader and a team behind that individual were placed on the incident management team, again, with that sole purpose of ensuring an all-of-response approach to identifying and addressing health disparities. SHIELD's efforts align with the Health and Human Service Agency strategy for racial and ethnic minority populations and our long-term plan for recovery and resilience of social and community health. Next slide, please. Next slide. So we know that there are some racial and ethnic minority groups have been disproportionately affected by COVID-19. Factors that may contribute to the increased risk of getting sick and dying from COVID-19 include discrimination, working conditions, healthcare access and utilization, income and wealth gaps, and substandard housing. In terms of healthcare access and utilization in particular, people from some racial and ethnic minority groups are more likely to be uninsured, and healthcare access can be limited for these groups by many other factors, such as transportation, child care, or ability to take time off of work. Occupation in particular plays a significant role in this epidemic. People from some racial and ethnic minority groups are disproportionately represented in essential work settings such as healthcare facilities, farms, factories, grocery stores, and public transportation. Some people who work in these settings have more chances to be exposed to the virus that causes COVID-19. In terms of inequities in access to high-quality education, this can lead to lower high school completion rates and barriers to college entrance. This may limit future job options and lead to lower paying or less stable jobs. People with limited job options likely have less flexibility to leave jobs that may put them at a higher risk for exposure to the virus that causes COVID-19. And lastly, housing. In some cultures, it is common for family members of many generations to live in one household. In addition, growing and disproportionate unemployment rates for some racial and ethnic minority groups during the COVID-19 pandemic may lead to greater risk of eviction and homelessness or sharing of housing. Next slide, please. It's also important to consider factors that influence access to medical care during COVID-19. Inadequate health insurance coverage is a major barrier to medical care, and unequal distribution of coverage directly impacts health disparities. Unreliable transportation also plays an integral role. A lack of transportation, particularly patients who have increased risk of severe illness from COVID-19, to miss medical appointments and potentially interrupt their ability to refill or acquire medications. Next slide, please. So with that as a backdrop, I'd like to talk about COVID-19 and end-stage renal disease. Next slide, please. Having end-stage renal disease increases your risk for severe illness from COVID-19. We've listed here some key actions to take if you are on dialysis. We recommend that you contact your dialysis clinic and your healthcare provider if you feel sick or have concerns. Do not miss your treatments. Plan to have enough food on hand to find the KCER emergency diet plan for dialysis patients in case you're unable to maintain your normal treatment schedule. Next slide, please. Background on this problem probably needs little introduction, but briefly, literature has shown that patients with end-stage renal disease requiring regular outpatient dialysis have worse outcomes after contracting COVID-19 when compared to non-ESRD patients. These outcomes include increased hospitalization, length of stay, cost, morbidity, and mortality. Next slide. A large study within the United States found that among 419 patients with ESRD, the odds of in-hospital death from COVID-19 were 1.38 times greater than those without ESRD who suffered from COVID-19, even after we adjusted for demographics and other comorbid conditions. Next slide, please. To further complicate COVID-19 in the ESRD community, the roles of SARS-CoV-2, which is the virus that causes COVID-19, transmission in dialysis facilities has not been widely described. Next, please. There are several reasons for this. First, dialysis facilities themselves make disease detection challenging because patients often enter from the community where exposures may be frequent. If testing is set up in a dialysis facility, disease detection among its patients would be easier since these patients reliably show up for testing. Furthermore, dialysis patients must present for the life-sustaining treatment of dialysis in an open and shared area for a prolonged period of time, usually 3 days a week, which increases their exposure to other dialysis patients and healthcare personnel who may be infected with SARS-CoV-2. Next slide, please. So some of our scientists here at CDC recently conducted a study at 4 Atlanta area outpatient hemodialysis facilities. The use of facility-wide testing to assess the burden of COVID-19 in outpatient hemodialysis facilities is not well described, and currently there are no recommendations to routinely test individuals without symptoms, known exposures, or an outbreak. In this particular study, of 361 patients tested, none were positive for COVID-19, suggesting that testing could be prioritized in facilities where there was actual transmission in the facilities, or save testing for facilities that did not firmly follow infection control practices, including wearing masks and aggressive cleaning of the facility. Next slide, please. Masking up, a key strategy. So a couple questions. People often ask, do I still have to wear a mask? Everyone in the community, including vaccinated persons in dialysis settings, still needs to wear a mask. We still don't yet know how well the vaccine, which does protect against severe illness, does it protect against actually receiving the virus itself. We don't yet know how well or if vaccinated persons can still transmit the virus. Any mask is better than no mask, but a good fitting mask is best. Recent CDC guidance indicates that there are ways to make masks fit better and be more effective, including adjusting the nose wire, wearing 2 masks where there is a disposable mask underneath and a cloth mask on top, and even using a fitter or cloth mask over a medical mask. Facilities that are screening patients are helping to find people who are infected earlier, but it's still possible for persons who are infected to not be identified in time to prevent transmission of the virus in dialysis settings. So it is critical to wear a mask in your dialysis center if everyone is being screened for COVID-19 before entering the facility. Next, please. So this is a report published February 10th, and then another one that was published in the Journal of the American Medical Association, where CDC reviewed the latest science about masks and affirmed that masks are a critical tool in the fight against COVID-19 that can reduce the spread of this disease, especially if everyone wears a mask. There is increasing evidence that masks help prevent people who have COVID-19 from spreading the virus to others. CDC continues to encourage masks because they are one of the most powerful weapons we have to slow and spread this virus, particularly when it's used in a community setting by everyone. And all Americans have a responsibility to protect themselves, their families, and their communities. But don't forget, masking isn't the only way to stop the spread. You can also do these 3 things: staying at least 6 feet apart from people you don't live with, avoiding crowds and travel, and washing your hands often. Next slide, please. Masks are recommended in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Masks reduce the spread of COVID-19 to others and protect the wearer. Masks are also most likely to reduce the spread of COVID-19 when widely used by people in public settings. Next slide, please. So again, giving a little bit more about the vaccine around certain medical groups. Next slide, please. Everyone who should get the COVID-19 should get the COVID-19 as long as they don't have a contraindication. If you have certain medical conditions, there may be a chance that you could be at increased risk for severe COVID-19 outcomes. We suggest that you consult with your healthcare provider for additional guidance or concerns. But if you have an immunocompromised situation, you too can receive the COVID-19 vaccine. But again, consult with your provider. On this slide is a website at CDC that lists more information about underlying conditions. Next slide, please. So a few key facts about the COVID-19 vaccination and some of the myths that are circulating out there. First, getting vaccinated can help preventing getting severely sick with COVID-19. The way COVID-19 vaccination works is that it teaches your immune system how to recognize and fight the virus that causes COVID-19, and this in turn protects you from getting sick with COVID-19. People who have already gotten sick with COVID-19 may still benefit from getting vaccinated. Due to the severe health risks that are associated with COVID-19 and the fact that reinfection is still possible, vaccines should be offered to you regardless of whether or not you already had COVID-19 infection. At this current time, we don't know how long someone is protected against getting sick again after recovering from COVID-19. A third myth that is out there is that COVID vaccines will give you COVID-19. None of the current authorized and recommended COVID-19 vaccines contain the live virus that causes COVID-19. This means that the COVID-19 vaccine cannot make you sick with COVID-19. And then lastly, COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. Neither of the two vaccines that are currently authorized, nor the others that are currently in trials, can cause you to test positive on viral tests, which are used to see if you have a current infection. If your body develops an immune response, which is the goal of vaccination, there is a possibility you may test positive on some antibody tests. Antibody tests indicate you had a previous infection and that you may have some level of protection against the virus. Experts are currently looking at how COVID-19 vaccination may affect antibody testing results. Next slide, please. So how can we address vaccine hesitancy? By building vaccine confidence, and that confidence is built on trust. Vaccine confidence is the trust that patients, parents, and providers have in the recommended vaccines, the providers who administer the vaccines, and the processes that led to vaccine development, licensing, manufacturing, and recommendations for use. A person has to have trust in all three of these items to feel fully confident in their decision to get vaccinated. This is a critical concept to think about when working with patient populations who may have a history of mistrust in the medical establishment or the government. Next slide, please. COVID-19 vaccination is an important tool to help stop the pandemic, but again, it's only one tool in our toolbox. While these COVID-19 vaccines appear to be highly effective, additional preventive tools remain important to limit the spread of COVID-19. The combination of getting a vaccine, as well as washing your hands, avoiding close contact, covering your nose and mouth with a mask, and clean and disinfecting frequently touched surfaces will help stop this pandemic using all the tools we have available. It will take time to vaccinate all people living in the United States. While these vaccines are being delivered, it's important that everyone continue to take all the steps. Again, wear a mask, avoid close contact with others, and wash your hands to prevent the spread of COVID-19. Next slide, please. So protect yourself, your family, your friends, your coworkers, and your community. COVID-19 can protect you, your family, your friends, and your community. Choose to get vaccinated when it is offered in your area. Participate in a program called vSafe, which is a program that CDC has to help monitor for any health effects that may occur after vaccination. Share your experience with your coworkers, friends, and family. Visibly show that you got the vaccine by wearing a sticker or button. Next slide. So lastly, I'd like to talk a few steps about what CDC is continuing to do in this effort. Next, please. So CDC, again, in summary, is taking action to address longstanding pre-COVID health and social inequities that have put many groups at increased risk of getting sick and dying from COVID-19. We are providing assistance to public health agencies and others to expand testing, contact tracing, isolation options, and medical care to reach groups that have increased risk for getting COVID-19 and having severe illness. We are working to build partnerships between public health agencies, tribes, scientific researchers, professional organizations, community organizations to share information and prevent COVID-19, particularly in racial and ethnic minority communities. We're offering technical assistance to local communities that have COVID-19 outbreaks in areas where there has been a disproportionate impact on workers that employ low-wage workers. We are supporting essential and frontline workers to prevent the spread of COVID-19 in critical workplaces, learning more about their concerns and challenges, and offering solutions to address them. We are developing guidance to implement programs and practices that are in different languages and are culturally tailored to diverse populations. We are continuing to build an inclusive public health workforce that is equipped to understand and meet the unique needs of an increasingly diverse population. And lastly, we are collecting data to assess and track disparities related to COVID-19 and developing new ways of communicating to the public and other decision makers. Next slide. We all have a part to prevent the spread of COVID-19 and promoting fair access to health. To do this, we all have to work together to ensure that people have the resources to maintain and manage their physical and mental health. We need programs and practices that fit the communities where people live, learn, work, play, and worship. We are facing a historic, unprecedented situation and learning that we need to empower our communities in order to win the battle against COVID-19. Until all communities can overcome this pandemic, America as a nation will not overcome COVID-19. A longer list of actions can be found on CDC's COVID-19 for Health Equity under What We Can Do. Next slide. And here is a list of essential and helpful resources that you may find of helpful reference. And with that, thank you for your time today, and I look forward to the rest of the presentations. Thank you.
Thank you, Dr. Singleton. Before we get to the questions from our audience, if you haven't already done so, you can submit any questions you have for Dr. Singleton using the chat feature or the Q&A through WebEx. We did get some questions earlier from some of our NPSC Land SMEs, and one of the questions was, is there a benefit to wearing 2 masks plus a face shield?
Yes, so our most recent studies show that the best mask is the best fitting mask around. So if one can, having 2 masks, one that's close fitting to the face, and then if the second mask, makes the fit even tighter, then that's bonus. The face shields have not been as frequently studied. The face shield, in addition to a mask, can protect against additional exposure to droplets. It's important to know that just wearing the face shield by itself has not been shown to be a safe way to prevent against COVID-19. So if you're adding an extra layer on top of the double masks, that's one extra layer, but it's not necessary.
Okay. Another question we received is, can you talk a little bit more about why people of color are affected by COVID-19 more often? What do you think people like myself can do to encourage more people to get vaccinated?
Okay, well, there's a whole host of reasons why we believe that people of color are more likely, or showing to be more likely to get COVID-19. Part of that has been documented that individuals of color may be in certain situations where they are in household living situations where they live in multi-generational families. And so if you're living with multiple generations, so grandmothers and aunts and cousins and children, so you got the young and the old and everyone's in a shorter space, then it's harder to get social distancing. And if someone in that household happens to then work in an industry where they can't work from home, and then it's getting exposed in the community, then that whole family unit then has a higher likelihood of getting exposed to COVID-19. So that's one scenario. Another scenario is that, unfortunately, people of color have tended to have had, in some cases, lesser, or I would say more unequal access to healthcare services. And when one has unequal access to healthcare services, then you may have some medical conditions that have not been well controlled, which then of course sets you up to be more likely to get the COVID-19 virus. So and then to your question about what can people convince people to do to get the vaccine? So I look at it like this. There are 4 legs of the stool that can help protect us against COVID-19, and all 4 are extremely important, and the ideal is to have access to all 4. So again, wearing your mask, staying 6 feet away from people if all possible, washing your hands, and keeping important social hygiene. And then last is to get the vaccine when it's available. The vaccine helps protect us against getting severely ill. It has been shown to be extremely effective in all population groups where it has been tested, and it can help keep people of color in particular out of the hospital and from having severe illness. And so for me and my family, we have made the decision that we would like to have all the cards on the deck for our family to help protect us as a family and to protect us as a community. And so that's something that you could recommend to say to people of color in particular who are considering, should I get the vaccine or not? It's an additional element of protection to help protect you and your family and your community.
You spoke of multi-generational households. Is there a benefit to wear masks if you are in that environment? If that's your home setup, to wear a mask inside of your home?
It could be helpful, particularly if there is a situation where someone in that household has to work in one of the essential industries where they do not have the luxury, as many Americans have had, to be able to work from home. So if those individuals are working in the community where there might be high community spread, and they are then living in a close household setting where there aren't spacious arrangements, it may be of some benefit when people are in close proximity to wear those masks to help both protect themselves, what we call source control, as well as to protect the droplets from moving to other people in that household.
Going back to our questions from some of the patients, is there any cost associated with getting the COVID-19 vaccine?
The COVID-19 vaccine there is no cost to the people who receive it. Some healthcare providers have the option to charge what we call an administrative fee, but those fees are not to be passed on to the patient. That they have to, the providers themselves, there's a special fund for them to seek that reimbursement, but no patient, no member of the community should ever be charged for the COVID-19 vaccine.
Is there a reason why a person with ESRD would not get the vaccine?
Well, they should talk with their provider, but unless they have some other additional contraindication, meaning that they may have, in rare cases, an allergy to one of the components of the vaccine, then they should be able to receive the vaccine when it is made available in their area.
Okay, another question we received is, do you still need to wear 2 masks after receiving a vaccine?
Yes, at this time, we are still recommending that people wear masks after receiving the vaccine for a couple reasons. We don't yet know how well the vaccine, it definitely protects people against getting severely ill and going to the hospital, and no one has died from the vaccine. So that's the best part. But we still don't know yet if you are protected from the vaccine, protected with the vaccine, you still may be able to actually the virus still can infect you. What we don't yet know is if you can then transmit it to someone else. And so that's why we recommend that people still wear their masks at this time after getting vaccinated, just in case there's a chance that the virus still might be in the community, come to you, and then you accidentally transmit it to someone else who has not yet been vaccinated. We are in the process right now of studying two people, if you put a pair of people together who've both been vaccinated and then they are exposed to the virus to see if there is transmission available. But right now, we just don't know. So the better part of protection is to wear your mask.
Okay. For our audience, if you have any additional questions, please submit them using the WebEx chat feature or the Q&A section on WebEx. Another question that we received, if I get the vaccine, can I start going back to hanging out with my family and friends, traveling on an airplane?
Okay, that's the question that everybody's ready. We're all tired of this pandemic. We're all ready to get back to what we used to be able to do. And as I mentioned before, hopefully this vaccine will be, again, this key 4th step of the toolbox to help protect it in this pandemic. So for now, what we recommend is that individuals still wear their masks. They still can visit their friends. They still can travel, but they really still need to wear their masks and still practice the other elements of COVID-19 protection. So after you get your vaccine and you're wearing your mask and your friends have gotten vaccinated and they're wearing their mask, then so be it. Go visit your friends, go visit your families. But until we get everybody vaccinated, we're asking people to hold off just a little bit longer until we can get the community vaccinated. And we're working as fast as we can, but it still may take a little while longer.
Okay. One of the questions that we just received, with wearing 2 masks, are there special precautions for safely removing them?
Yes. So if you're wearing, let's say, a cloth mask over the top of, let's say, one of the paper disposable masks, you should always still use the same precautions. Release the mask from the side, from behind the ears, pull that off one side. So let's say if you're starting from your right, go to the left, put that mask down. Then the same thing, repeat the same process from the right side. If you start with that side, if you're right-handed, and then pull from the left. Or you can pull them both together. Those masks, if they're disposable one-time use masks, they should be only used one time. Cloth masks should be washed in the warmest possible water that you can have, and then dried, ideally in a heat dryer. And then when you take off your mask, ideally place it in a paper bag or some sort of container, so that it won't get soiled. If your mask does get wet or soiled, then it should not be used because it's not as effective when it's been wet or soiled. And our webpage on the CDC website has information on how to care for your mask.
Okay. Just received another question. Not sure I understand it, but maybe you will. Is it safe to use the plastic braces under the mask so it's easier to breathe?
So I think the questioner is asking, there have been some mask fitting molds that companies have come out with to try to make the masks fit tighter across the face. And so, yes, those those devices can be used on the inside of the mask, or use it with if you're wearing two masks, that's one way to hold it down. Or if you're using a single mask, they're useful to pull the mask closer to the face. The idea is that they help. Sometimes some of the cloth masks that are out there, particularly if you have a small face, may not be the best fit. And so if you've got gaps around the sides or underneath your chin, then it's not as helpful because the virus can sneak up underneath there. So those new fitters, those plastic molds, help pull away some of that open space and keep it tight across your face.
Okay, I understand now. I think this is our last question. Can I get the vaccine and have dialysis on the same day, or should I have my dialysis treatment one day and get the vaccine the next day?
Wow. That one, I think you will probably check with your facility. There is no contraindication. So let's say if you were Monday, Wednesday, Friday, and you happen to be able to get your vaccine on a Monday, you can go straight on in there. You may notice, keyword may, and sometimes the day after the vaccine, some people, I know when I got mine, my arm was a little sore for a day, and then I was fine after that. And so you may, some people sometimes the arm is sore, or they may just feel tired. And so that might be a reason to put a little bit of distance between the two. But if you're normally certain days of the week and your vaccine happens to be on that same day, don't push it off your dialysis. So, put them together.
All right. Thank you, Dr. Singleton. We appreciate the feedback that you've provided us, answering all those questions. Very important information you provided today. So thank you very much.
Thank you.
All right. So as we start to conclude this call, we'd like to share a few resources with you. The first is the new Quality Assessment and Performance Meeting resource. The tool was created with the assistance of patient subject matter experts to help patients prepare for coffee meetings. Patients can learn what to expect before, during, and after a coffee meeting. To get a copy of this resource, visit the ESRD NCC website and click on the patient icon. As you are searching the web for information, it's important to make sure you are going to credible resources. The NCC offers a few resources for finding credible information on the internet. Visit kidneycovidinfocenter.com and click on For Patients. Next slide, please. For our final resource, we want to remind everyone about the kidneyhub.org. It's a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. A diet and nutrition section was recently added. Check it out today. Before I tell you about the next COVID-19 webinar event, I want to tell you about the NPFE Land Summit. In partnership with the Centers for Medicare and Medicaid Services, the ESRD National Coordinating Center invites you to join us for the 2021 National Patient and Family Engagement Learning in Action Network Summit, Patients Partnering in a Pandemic. The virtual summit is taking place Monday, February 22nd and Tuesday, February 23rd. Attendees will hear from CMS leadership about how COVID-19 has changed the healthcare system, and patients will share how they are thriving despite COVID-19. Other topics include home dialysis, kidney transplantation, and emotional well-being. To register, visit the ESRD NCC website and type in NPFE Land Summit in the search box. Our next professional COVID-19 webinar event is next Wednesday, February 24th at 3 p.m. Healthcare professionals can earn 1 CEU for attending this event. The patient COVID-19 webinar event scheduled for March 2nd has been canceled. Thank you all again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. Thank you, everyone. Have a good evening.